The COVID-19 pandemic changed life as we knew it, the effects of which forced industries and businesses to change the way they operated overnight. In the healthcare industry, the rapid shift to telehealth was executed with lightning speed.
During the pandemic, folks were afraid to go into the doctor's offices, into the emergency room, and a lot of healthcare providers closed their offices. So the only way that people could see their provider a lot of times was virtually through what we call telehealth. So telehealth exploded.
Before the pandemic, we did less than 2% of our patient visits were done via telehealth, virtual care. 60 days after the start of the pandemic, close to 70% of our ambulatory visits were done via telehealth services. And this created greater disparity in access to healthcare for disadvantaged and vulnerable populations because in many areas they didn't have access to reliable internet services and didn't have the digital literacy to know how to use the PCs and equipment that you need to be able to access telehealth services through our providers.
Increased reliance on digital technologies further exacerbated pre-existing disparities and disadvantaged patient populations, forcing state and federal leaders to invest in broadband expansion.
Effective telehealth visits require internet access. You need the bandwidth to be able to access your physician through the internet and is required in order to provide video and audio capabilities for the physician and the provider. Pandemic really forced state and federal legislature to invest in broadband, especially in rural, underserved areas, because quickly we found that access was difficult for many folks. Also, there was competition where there was limited bandwidth with schools, because many of the school children were home taking virtual classes at that point as well.
While broadband expansion is helping to close the digital divide, further development in education and technology is needed to expand access and make a real impact.
There's not nearly as much healthcare access in rural areas as there is in the urban area. In the urban area, you have doctors right down the street. You can take a cab to get to your doctor's office. In a rural area, it's hard to recruit physicians and other healthcare providers to those areas. And so telehealth is a way to bring healthcare to a community, to the person where they're located. And we believe that a person's health care should not be determined by the zip code that they live in.
Education is an opportunity to empower each individual to make their own decision and understand what it is that they need when it comes to technology. So by spreading awareness about the devices and how to use it, how to connect with others, how to connect to affordable internet solutions, it allows the individual to play a huge role in their technological journey.
As telehealth technology expands access to care throughout rural communities, opportunities in healthcare literacy are helping to educate low-income residents and seniors on how to safely use the internet.
Through this program, we provide digital literacy training, we provide technical support, we provide assistance with application and enrollment into affordable internet solutions, such as the Affordable Connectivity Program and the Lifeline program that's funded through the Federal Communications Commission. You can see technology everywhere, so if you don't have the digital skills that are needed, you will be left behind. So it's an important part of being able to thrive in today's world.
Connecting individuals to quality of life resources through digital literacy trainings is helping to close the digital divide in rural and underserved areas.
By incorporating the 5 elements of digital inclusion named by the National Digital Inclusion Alliance, which is offering affordable internet solutions, digital literacy training, digital devices, online content, and technical support.
If a person doesn't have a device to use at home, like a cell phone, a laptop or a tablet to do their own telehealth visit, then you're not able to complete that visit. So what we've tried to do is to put telehealth equipment out in rural access locations. So in local pharmacies, we have carts in the churches, we have them in some public housing areas around rural communities.
Increased affordability and access to both the internet and to hardware will continue to connect more people with the vital care they need.
The Federal Communications Commission has several programs that provide subsidies for broadband. One of those is the Rural Health Care Program, which provides subsidies to eligible healthcare providers so that they can take dollars saved and put it back into direct patient care services. And since 2013, we have saved healthcare providers in South Carolina over $45 million in broadband cost. It enables them to get care wherever they are. We've had some patients where their provider has gone overseas to do missionary work and they were able to stay connected to their provider during that time. It did not mess with their continuity of care. So it enables a patient wherever they're located to be able to receive good quality healthcare services.
As technology continues to expand, it is creating a path for telehealth to become a prominent force in the future.
Wearables and remote patient monitoring technology allows us to monitor patients with chronic conditions much better. We can continually monitor, and when we see conditions change, it'll alert one of our care coordinators who can notify the physician that's responsible for their patient, and we can take action quickly. We see telehealth expanding and growing for the foreseeable future. It provides opportunities to manage our patients and keep them healthier as we shift our healthcare model from episodic and taking care of patients' illness to helping them manage their health and hopefully having them get engaged with managing their health as well.